First off, I'd like to welcome everyone to our webinar today. We're very pleased to be hosting a webinar on water quality and environmental justice in California's Central Valley with a fellow who really is at the center of the research and the work being done there. Dr. Carolina Balazs is joining us today from California. Welcome, Carolina. I'm going to go ahead and unmute you so you can say hi.
Hi, everyone.
And I'd like to just take a moment to go ahead and introduce you, and then I'm going to turn it over directly to you so you can tell us what you've been discovering. Carolina is a postdoctoral fellow in the Environmental Science and Policy Department at the University of California, Davis. And she has worked as a research scientist with the Community Water Center for many years now, with support partially from the Switzer Foundation. So we've been very pleased to help support that work. Her research focuses on environmental health, environmental justice, and regional planning issues, and how those all relate to access to clean drinking water in rural California. She uses qualitative and quantitative analytical approaches, which she'll be going into today, as well as participatory action research. Dr. Balazs received her PhD and her MS from the University of California at Berkeley's Energy and Resources Group, or ERG, and her BS from Brown University. So again, we're very pleased to have you here today with us, Carolina. Welcome.
Thank you, Lauren. And you mentioned it, but as I'll be talking about my work for the last decade or so on water quality and environmental justice in the Valley, and the Switzer Foundation has played a key role both in graduate school and then helping support my role as a research scientist with the Community Water Center. So I appreciate that support and look forward to giving you all an overarching story of both some of the problems with water quality in the Valley and then the solutions that are being worked on the ground currently. So as Lauren mentioned, the key questions that we'll go over today are, what are some of the key drinking water issues in the Central Valley? What's the role of regional planning for addressing some of those problems? And how does this all relate to environmental justice? And the way that I want to answer those questions is really by digging deeper and asking, why are there social disparities in access to safe drinking water, and what is that role that regional planning can play? So the outline of what we'll go through, and you can sort of see it along the top as well, but I'll start with, there's sort of three parts to the talk. I'll start with a very broad brush overview of the problems of drinking water contamination and exposure, and then look at some of the drivers of those problems, and then we'll end with a case of one type of solution that's being used. So to set the stage, there's one quote that I feel like really captures the reality in the Valley in California, which is that we have the most prosperous state of the richest nation in the globe, but in this prosperous state, there are towns with third world problems. And the community that can exemplify this quote is the community of Tooleville, which is a small community of about 350 people in Tulare County. There's 3 roads you can see in the picture here. One of them unpaved, no sidewalks, unpaved roads, no sewer, and high levels of nitrate. And about 1 mile north of Tooleville is the city of Exeter. And this is a mural from the city of Exeter, which shows this beautiful picture of their orange industry that they have just in the foothills of this area. And while the mural looks really beautiful, what it doesn't capture, which is this photo to the right, is that the water that's providing water for the trees is coming from the Sierra. It's pristine water being used for agriculture. And yet the orange groves require high levels of nitrate fertilizer. And because the groundwater table in that region is very shallow, what happens is the groundwater is highly contaminated. And so the one well, which is shown here in Tooleville, has had high nitrate levels for over 10 years consistently, and the community hasn't been able to deal with this problem. So common questions that I've heard throughout my work in the Valley in relation to Tooleville and other places like Tooleville is, well, isn't this just an issue of economies of scale, where you have small systems that are facing big problems? Or I've heard questions like, if you're talking about environmental justice, are you implying that someone's deliberately polluting people's water? Or why don't people just move if they want to solve this problem? So we'll indirectly look at these questions throughout the webinar today. But what I want to do to frame those questions is draw on two notions of environmental justice. One is distributional, which is how is an environmental harm distributed in society? And secondly, procedural justice. What are the programs and policies that are being implemented? Are they being implemented equitably with meaningful involvement of all stakeholders? And to shift now, with that in the background, what I want to do is move into part one, which is giving an overview of the problem. So here we have a map of California, and this is a recent research project I've been working on that's looking at cumulative impacts of drinking water. And what we see here is scoring of all the census tracts across the state. And the more red you are, the higher levels of contamination you have. And what this approach is showing, and we can get into it in the Q&A if people have questions, but basically it's showing what we've known for some time, which is that the Central Valley, which is in that black circle, has some of the worst water quality in the state. It has the largest fraction of nitrate violations, arsenic violations, DBCP violations. It's not just communities that have a problem, it's the schools that have high levels of drinking water contaminants. And then if we think of it cumulatively in terms of the multiple types of water contaminants, the valley's generally scoring the highest across the state. So part of the explanation for this is shown with this aerial photo here in the next slide, which is that the valley is one of the most agriculturally productive regions in the world. And as such, it has two of the most contaminated aquifers resulting from that ag productivity. And this is a problem not just for the environment, but for the people living here, which is because 95% of that valley population relies on groundwater for their drinking water. And this is further compounded by the demographics of the valley. It's one of the poorest regions, not only in the state, but in the whole country. And it has a very socially vulnerable population, both of farm workers, migrant workers, and just the general population in the valley is exposed to a variety of environmental contaminants. So drinking water is one piece of this environmental health issue. To dig in a little deeper with nitrate, so we know agriculture uses large amounts of nitrate. It's the key cause for these high violations of drinking water levels in the valley. And nitrate is an acute health contaminant. So it can cause death in infants and reproductive problems for pregnant women. So there's a health component, but there's also a community cost, which is that to mitigate high nitrate is very expensive. So when you have poor communities that can't pay for treatment, you have an added exposure problem. So what some of my earlier research, Lauren, is there a question or is that just feedback?
No, it's just somebody's mic.
Okay.
Sorry about that.
So some of my first sort of layer of research in the valley was to look at what's the exposure problem, and specifically are there social disparities in exposure. And there what I found with my colleagues is that small communities with higher percentages of Latinos had higher nitrate levels. So it wasn't just that the valley overall has high nitrate levels, it's actually impacting small communities and communities of color disproportionately. We found similar results for arsenic, where lower income communities had higher arsenic levels than higher income communities. And communities of color were more likely to be in non-compliance with federal drinking water standards. So all of this pointed to the fact that yes, there's a drinking water problem, and there's also disparities in who's impacted by the problem. So I'll shift now to part two, but I just want to see if there's been any questions, Lauren, or if I should keep moving forward.
Nope, so far we're good. And just a reminder to those of you listening, if you have a clarification question during the presentation, feel free to use the chat window to pose it, and I'll make sure it gets answered before the presentation ends. Sure. Thanks, Carolina.
Okay, so shifting now to, if the first part is giving a sense of the problems, what's driving these findings or these problems, I developed with one of my co-authors, Isha Ray, the Drinking Water Disparities Framework to try to get a sense of what's going on to drive the patterns that we were seeing. And so if we return to the story of Tooleville, one could argue that certainly there's natural environmental factors such as the climate that promotes citrus growing in this part of the county, and the built environment, which has agriculture and channeled water going to agriculture. All of that is shaping the exposure that the community is facing. But then there's this question, is it just that Tooleville is small and that's why there's a problem? What I'll do now is walk us through how it's more than just economies of scale, really. And here what I have is a diagram of the framework where there's 3 types of environmental factors that we can think of. One is natural, one is built, like how humans have modified the landscape, and the third is sociopolitical, the institutions that we've set up. And there's multiple levels from regional down to the household. And I'll walk us through an example of how the interaction of those factors with different actors, people or institutions at different scales, all of that impacts exposure. And down below at the bottom of the slide, you can see what in public health is the classic exposure disease paradigm, which says if you have a source of pollution, that'll lead to exposure, you have a dose of that exposure, and that results in health effects. And what I want to show is how really from a social epidemiology perspective, there's much more at play than just source of pollution to exposure. And so one example of how we can see this framework in action is looking at county planning policies. And what's here on the screen is an excerpt from the Tulare County General Plan from 1973. It was on the books until just last year where the plan has been modified. But you can read that the county's official plan was that public commitments to communities with little or no authentic future should be carefully examined. And they note that non-viable communities would, as a consequence of withholding major public facilities, such as water, they'd enter a process of long-term natural decline. So this is official county policy to think about withholding resources. Then they go on to say that unincorporated communities which are expected to lose populations are the following. And listed here are several unincorporated communities. One of them is Tooleville. And so what we see with this example is that county planning policies have continued to marginalize the already marginal. So they've made decisions around what communities are viable, where they project growth to occur, and where to withhold resources. And one could argue that this is economically rational from a planning perspective. One could argue it's redlining, where it's discriminating against certain communities. But from a water perspective, the ultimate issue is that it's perpetuated poor infrastructure and access to resources in places like Tooleville to solve their problems. So I have more examples that we can get into in the Q&A, but the short story here is that there's a variety of factors, whether they're from the built environment, the socio-political environment, and all of those intermingle and work through different levels of actors to impact exposure. Now, we could step back and say, okay, if people can cope, then we could basically not have an exposure problem. But let's see how the same framework can help us understand the impact for coping mechanisms. So here is the case of a community of Alpaugh, which is also in Tulare County. And they have had very high arsenic levels, over 50 parts per billion since the 2000s. And in 2005, they got about $4 million to upgrade their water system. But in the process of upgrading their system, they didn't plan for the fact that 2 years later, there was going to be a tighter drinking water standard for arsenic, where they'd have to serve water at 10 parts per billion or less. So they had this upgraded system, $4 million poured in, and they couldn't meet the safe drinking water standards. So here's some quotes from the local papers. They note that Alpaugh's water will come from a well with an arsenic level that's too high to meet federal standards. One local leader said, we've gone through all these trials and tribulations, and starting in January, what are we going to do? As one of the technical consultants noted, officials were just focusing on getting water flowing. Once that was accomplished, they would worry about the arsenic issue. So a lot of this problem with Alpaugh was attributed to having poor baseline conditions of technical, managerial, and financial capacity, or TMF capacity. And that is generally noted in the engineering community as, you know, a key problem for not being able to plan appropriately. So we could say, well, Alpaugh just had poor TMF capacity. That's why they didn't plan appropriately. But poor TMF capacity is also shaped by the social vulnerability of a community. So here's a picture of the office of the Alpaugh Water District. And if you compare that to the office of Fresno, which is just, you know, an hour away, it's completely different reality. And the district here is run by a volunteer board. So one regulator was saying, they live there, they're residents, they don't really understand our regulatory requirements. So basically the regulators are aware that it's not really just TMF, it's the fact that the community is drawing on a less resource set of stakeholders to manage their water. Now, funding eligibility also plays a role here because until recently, communities to access state funds or federal funds, they had to show that they had TMF in order to access funds. Similarly, in 2009, the American Recovery and Reinvestment Bill earmarked $160 million for California drinking water projects, but they noted that they had to go to high priority or shovel-ready projects. And what that means is a community has to be ready to hit the ground running with their project as soon as they get the funding. Now, places like Alpaugh and Tooleville have a lot of planning work and pre-planning work to do before they can even know how to tackle their problem. And so the funding processes that were available were basically keeping out communities like Tooleville and Alpaugh. And so what I show here below is there's this continuous cycle of lower income communities having few resources, which impacts their TMF capacity. That then limits their ability to obtain funding, and it's this ongoing cycle. And there's this cartoon from a Tulare County newspaper that shows Tulare County rural towns going to Department of Public Health to access funding and meeting a brick wall, basically. So that shows how the systems have a hard time coping. But if a system can't cope, then it's basically passed along to the household as a responsibility. But what happens here is that there's regulatory failures at the household level. So this is an excerpt from the Consumer Confidence Report, which is sent out to residents when there's a water quality problem. And in Cutler, they've had high levels of DBCP, which is an insecticide that's particularly harmful for the male reproductive system. And what they note is our system has recently failed a drinking water standard. This is not an emergency, but you have a right to know what you should do. And then if you go further down, it says, well, what should I do? First, they say you don't need to use an alternative water supply. And then they say this is not an immediate risk. If it had been, you would have been notified immediately. However, some people who use water containing DBCP in excess of the MCL over many years may experience reproductive difficulties. So there was a UN visit by the Special Rapporteur for Water and Sanitation in 2011. And one of the residents came to testify and said to her, here's my notice. I've been receiving it for several years. Does that mean I should keep drinking the water? Isn't this a problem? And so what this resident was noting is basically that there's a regulatory failure because the right to know isn't translating into an appropriate right to act. And more specifically, there's lack of clarity around what do you do when you have co-occurring contaminants or ongoing chronic exposure. And so one of the regulators in my interview process said, well, as long as the customers know that the water meets the standard or doesn't, they can act on that. But in fact, the information that's being given isn't enough for people to know how to act appropriately. I'll skip over this last example just for time. But to close this section, basically we see this bigger picture set of factors that we saw for exposure also influencing coping, where there's a interplay of environmental factors and how they play out through different levels of actors to impede successful coping. And so in sum, for this section, what we see is that there's a composite burden, which is comprised of both exposure burden and coping costs and the ability to appropriately mitigate. And so this leads to multiple levels of vulnerability for households, communities, and the region as a whole. And I'll stop for a second just to see if there's been any clarifying questions.
So no clarifying questions, Carolina, but we have a few bigger questions from Josh, but we've agreed to hold those until you start the Q&A.
Okay, great.
So I have a few questions to start you off with Q&A.
Okay, great. So in the last few minutes that remain, I want to briefly go over solutions, and this could be a whole topic of discussion, but I wanted to narrow in on one set of solutions that I've been working on with both through my Switzer grant and then my more recent work at Davis and with the Community Water Center. And basically, we went over some of the problems earlier, and now the solutions are also multi-level. There's things that are happening at the state level, regional level, and community level. But I am going to zero in on regional solutions for now. And one of those is looking at integrated regional water management and its potential. So integrated regional water management is a key planning and funding approach for water management in the state, where you're basically dividing up regions, bringing together multiple stakeholders, and seeing if you can come up with multi-benefit solutions. And so there's been two efforts that I've been a part of, the Tulare Lake Basin study and the Kings Basin study, that's tried to both model how this process should work from an environmental justice perspective, and it's tried to actually get work done for these communities. And so the Kings Basin Disadvantaged Community Study, a lot of words there, but this is a study that I'll just briefly give some hints at what we did, but basically this is the northern part of the San Joaquin Valley, and we divided that region up into 5 subregions. There's about 200 total disadvantaged communities in that area. And we brought together community members, government representatives, and advocates from each of those subregions to both identify water needs where there's communities with water problems, and then engage those communities with water planning, where communities were co-leading the development of solutions, and the consulting team was facilitating relationships between these communities and traditional water planners. And so one example of a project that emerged from this process is 7 communities in the northern Tulare subregion came together, and through mapping exercises, they saw that they not only shared common water problems, but they were close enough in distance that if they all came together, they could share some of their operations and management services to both address water quality issues and save money for residents. And so there's more to say about that, but basically this was a really nice example of what happens when you bring communities together and they can start visioning what they want together. So we saw this as a model for both more equitable engagement and planning, and as a model for thinking about developing multiple impacts, where we're learning more about what the region needs, and we're also ultimately changing governance and power structures, because people that have traditionally not been involved in water planning are now more involved. So with that, just a quick summary of what we went over, but we have some of the worst water quality in the Central Valley. There's disparities in exposure, and this is comprised of a composite burden. And that really defines the nature of water injustice in the valley. And when these vulnerabilities occur, the burden is further compounded with additional issues. So the current drought, for example, or thinking about cumulative impacts, all of that is exacerbated in these more vulnerable communities. So ultimately, we need solutions at multiple levels that can work towards getting communities clean, affordable drinking water. And we went over some of the regional solutions. There is a lot of momentum right now. It's a really exciting time for drinking water and environmental justice in the state. And so I've just listed some of the current efforts that are going on or have gone on in recent years. And with that, I'll just acknowledge some of my co-authors and the Switzer Foundation and Community Water Center and open it up for questions.
Super. Thank you so much, Carolina. So this is Lauren Hertel again with Switzer. I'm going to be facilitating the Q&A period, and there are a lot of you on the call, which is very exciting for us, but it can make Q&A periods a little chaotic. So we're going to try and minimize the chaos and keep things flowing. We do have a few questions that came in via chat while you were speaking, and so we're going to start with those. But for the rest of you, while Carolina is answering these first few questions, you have two ways that you can pose a question. The first way is via the chat window. You can just type it in and either submit it to everyone so everyone can see it at the same time, or just send it to me privately. And then we also are more than happy to take audio questions as well. In order to ask a question via audio, all you'll need to do is unmute yourself. You're currently all muted. To do that, you click the little red microphone button next to your name, and that will unmute your phone. Just keep in mind, some of you may have muted your actual physical phone in addition to being muted on WebEx. So if we don't seem to be hearing you, then make sure both places are unmuted. So let me go ahead and start with a few of these questions that have come in. A couple of them are from Josh Franco, and we have some other questions as well. So Josh's first question, it actually goes back to your slides about Tooleville. And he said the county appears to be making a trade-off between agricultural production and community livelihoods. And he was asking and wondering what the debate was surrounding the adoption of that general plan and that particular clause that you cited. I believe that was from the 70s.
What the debate was around that clause in particular?
Right.
So the broader comment, yeah, I think in the Valley in general, there's always, the agriculture industry is a very strong lobby, and so each county and across the region, there's always a balancing act between agricultural productivity and meeting community needs. So that's definitely the case. What was surprising with the clause that I pulled out there was it was actually a group of lawyers from CRPE, the Center on Race, Poverty, and the Environment, that were getting comments together for the new general plan and uncovered this clause. And so there actually hadn't been much debate or knowledge that this had been on the books as a formal policy. And upon discovering that clause, there was a lot of pushback, a lot of organizing, and the new general plan, of course, doesn't include that clause and, reflects more of what some of the community needs are. And in Tulare County, partly as a result of the Tulare Lake Basin disadvantaged community study, the county is now, at this point in time, they're very much on board with the fact that there are drinking water issues, communities need support in figuring out how to address it. So there's much more collaborative environment towards thinking about how to work on these issues. That doesn't mean there aren't challenges still, but the county is, I'd say that example is more of a historical example explaining where we've gotten today.
Mm-hmm. Super, and he had a follow-up for that actually about any post-American Recovery and Reinvestment Act legislation that's been considered at the state or federal level, if there's been any, to directly address the lack of resources that these communities experience.
Yes. So as I mentioned at the end, it's been a really exciting time for drinking water broadly for the state, and largely as a result of the grassroots drinking water movement. A lot of things are changing at the state level. And so, for example, in the last year or two, there's now more specific funding set aside for disadvantaged communities, where this TMF requirement is basically not a requirement for that pot of money, because there's a recognition that disadvantaged communities need to be able to access funding. And just overall, there's a big consideration of how to restructure funding requirements across agencies, whether it's USDA money or state revolving fund money. There's different pots of money that communities can access. And I would say largely as a result of strong advocacy, there's been shifts to funding. And the governor last year, but it was a several-year process, had a drinking water stakeholder group comprised of all kinds of stakeholders from ag to drinking water and environmental justice. And they also were thinking about what are the types of solutions that we need to address this problem. And so a piece of that was how can funding sources better meet the needs of communities. So we've shifted a lot, and the talk as a clarification was to give us a sense of where we're at today and why we're there, but there's been great movements forward in the last few years.
Mm-hmm. Super. The next question comes from Daniel Mountjoy. He's asking how many of the disadvantaged communities are incorporated, and if the number is low, how do they participate in the integrated regional water management process if they're unincorporated?
Yeah, so one of the problems is the majority are unincorporated. For the Kings Basin, for example, of the 200 or so, this is just a rough statistic, maybe 3/4 are unincorporated and 1/4 are incorporated as cities. And in terms of the planning processes, basically, whether you're incorporated or not, you can still participate. The problem with being unincorporated is that until now, you've had to rely on county resources for any funding because you can't levy your own taxes. But in general, those unincorporated communities, they're smaller, they have fewer institutions, and so they have just less capacity overall to access funding, to know how to engage in planning processes. And so all these regional planning efforts are trying to bring everybody in, but certainly the unincorporated communities have a harder time. And the other thing I'd say about that with the Kings Basin, there's a group, the Integrated Regional Water Management Group for the Kings Basin, and until recently you've had to pay dues to be a member. And again, the ability to pay and be a member then means you can vote on decisions or apply for funding if you're a member. But these unincorporated communities don't have those funds to pay to play, so to speak. And so there's now discussions of how can they restructure their governance so that either multiple unincorporated communities pool their resources and send one representative, or is there a waiver for membership dues for unincorporated communities? So luckily it's a good thing that it's being discussed in the Valley, but it is an issue for those communities.
Super.
I hope that answered the question.
If it didn't, let me know. The next question is actually from Aaron, and I know that I have a few questions to come back to for both Daniel and Frank and Josh Franco, but I wanted to give some other folks a minute to ask questions. Aaron Appenshill had a question too. Aaron, would you mind if I call on you via audio? I'm just going to go ahead and unmute your mic. I hope that's okay. And if you wouldn't mind asking your question via the audio, that would be great.
Sure. Can you hear me okay?
We can. Hi, Aaron.
Great. Hi, everyone. Carolina, thank you so much for your presentation. It was really fantastic. I just would love to hear sort of what your thoughts are on the new groundwater legislation and what you think will be. Obviously, there's a lot of power being given to the sort of local and more regional water districts to implement the legislation, and just would love to hear your thoughts on sort of what the most important aspects of successful implementation will be.
Yeah, that's a very timely and pressing question. I think for those that may not be aware or may be aware, but California recently enacted groundwater legislation. It was the last state in the West to decide to regulate groundwater. Until now, users can pump as much as they want, and while there's regional water quality standard setting and monitoring, there was no regulatory enforcement mechanism. So over the next 15 to 20 years, the institutions are going to be set up to actually regulate groundwater use. So the huge success huge success, and it will be a complicated process. And from the environmental justice perspective and community, one of the key questions and things to look out for is that basically just the way that the negotiations occurred and how the final legislation turned out. Each groundwater basin will basically be in charge of setting up its rules and institutions for how to regulate the groundwater. And what that means is that traditional water managers and players will, if left unchecked, those are the groups that will be deciding how to regulate the water in their basin. And so from the EJ perspective, what's being discussed is that there needs to, in order to not replicate current power structures that have disenfranchised many communities or many issues like drinking water, there needs to be a really critical effort at looking at how do all kinds of stakeholders engage in this process so that it doesn't just replicate water management as usual. And I think the reason I brought up the integrated regional water management as a one of many solutions is that from my perspective, I think that we can learn a lot from that experience at how you need to both open up governance structures and how you need to think about working collaboratively in a region. And the King Basin has been a really model region for being willing to consider that disadvantaged communities need to have a place at the table, and it can't just be irrigation districts and cities making water management decisions. And so I think with the groundwater legislation, that's something that the EJ community is thinking about, is how to make sure that those governance decisions will be accessible for everyone. So I think there's a lot to see how that will develop, and people are actively starting to think about how to work on that.
Super. This is Lauren Beck. The next question we have is from Deldy Reyes. Go ahead, Deldy. Your mic is open.
Okay. Hi, Carolina.
Hi, Deldy.
Hey. So I'd be interested to know from you how you see the recent shift of jurisdiction within the state from drinking water infrastructure funding going from DPH to the Water Board. What kinds of opportunities do you see this presenting?
Yeah, that's a good question. So just the background there is that until now, the Department of Public Health, the California Department of Public Health, had been in charge of ensuring compliance with the Federal Safe Drinking Water Act. And so that means both regulating community water systems, public water systems, and administering funds. And through recent efforts, there was a push to move that program to the State Water Board. So that's what Deldy's asking about. I think it's a great opportunity. I know what currently is going on, and Deldy, you may know this more than I do, but there's the State Water Board has shifted staff over to set up this whole program and has several stakeholder processes to make sure that they do a good job in their new program. And I think, personally, I think from a data management perspective and regulatory perspective, I think that the State Water Board will have the capacity to do both the regulatory piece and the administering of funding in a strong way, and in a way that is probably stronger than what Department of Public Health was able to do. And one reason is just that the State Water Board has a much broader experience with administering funding. And so I think at least what we're seeing initially is there's much more openness to considering funding guidelines, how to manage data, and I think it's still in the early phases, but I feel hopeful about it, and I believe my colleagues from the different water justice organizations are feeling really hopeful. And the third part is that State Water Board has shown just a big openness to getting input from stakeholders. And one of the problems with Department of Public Health in recent years was that they were more closed and reactive to whether it was environmental justice groups or advocates asking to change things. They felt more reactive to me, and I think the State Water Board is taking more of just an open and proactive approach. And so that feels really hopeful from a procedural justice perspective, that there's just a more open channels of communication.
Thanks.
Super, thanks. And just so you know, Delzy lost audio there for a little bit of that answer, but we'll make sure that the video recording gets out to her and everyone. I did want to remind everyone that we are recording this, and we will be providing a link to the recording on our website in the next couple of days, or at the latest early next week, both so you can review it and also forward the link to colleagues who may not have been able to attend today. I wanted to just jump back to Josh for a minute because he had another question. I'm just finding it here in the chat. And he has to log off in just a minute to go to another one. So he's saying that the integrated regional water management approach aggregates sub-watersheds together. How did upstream sub-watershed users interact with downstream users? And what was the interaction with major agricultural users and water authority?
Mm-hmm. So let's see, in the Kings Basin, how do I answer that question? In the Kings Basin, I think there was less focus on upstream, downstream users, mainly because I guess one could say there's upstream users on the Sierra side, but it's, at least from what I saw, it's not really how the water issues were being discussed. It was much more around who's using what water, whether it's like the ag industry, environmental needs in cities. So that's sort of how I might respond to that. I feel like there was another part to the question, Lauren, that I didn't quite capture.
And I'm searching for it as well here. I've got a lot of chat questions here coming in. The first part was knowing, sorry, I'm just trying to search through here. It was about the sub-watershed. It was about the upstream, downstream users, yep. And then also about the interaction between major ag users and the water authority.
The water authority, like the Integrated Regional Water Management Group?
I think that's what he means. But Josh, if you're still on and you can feel free to open your mic and ask it more succinctly than I'm doing. I'm doing a terrible job here.
No,
hi, Josh.
Hi. Hi, Lauren. And hi, Carolina. Great presentation. So I'm interested in the interaction between the major agricultural water users and say, like, I'm not sure if it's the Friant Water Authority or what water authorities are in that basin, but like, how do they interact when they're in front of an audience of a diverse audience of people? Because typically, my assumption would be that they're pretty cozy, but maybe that wasn't the case that came across in those meetings.
Yeah, cozy meaning, what do you mean by that?
Like they know each other, they work with each other, the water authorities generally exist to send water to the major agricultural users as opposed to small communities like Tooleville. Yeah. So I think part of my work has been ethnographic, where I'm observing these social dynamics and cultural dynamics, and the big water players in the valley are used to being the main people in the room and making the decisions. And so in these IRWIMP meetings, it was definitely a shock for their system, I would say, to have to now engage with both a water issue that they haven't had to or haven't wanted to engage with, which is drinking water, and a population, whether it's Latinos or just more marginalized economic groups. I think they've been used to being the ones at the table. And so I saw a lot of cases of, some of it was blatant discrimination, some of it was just, cultural unawareness and just the needing to reshift. And so from like a social researcher perspective, it was very interesting to see how these processes of opening up water management are causing new conversations to occur and new dynamics. But I'd say it was a spectrum, because some of the
water management authorities are much more traditional, and others are, are more open to thinking about things in new ways. And so I think this whole integrated regional water management approach, at least in Kings, has forced this type of interaction. And I have a paper that was recently published that was getting at this, but basically what I found for the Kings Basin is that this has allowed for an opportunity for cultural and governance changes within this water management structure. And so there are hiccups along the way, but I still feel like it's a very promising approach when you have the right, the well-intended leaders, which the Kings Basin has. And I think it's been good. I've been doing interviews with other regional water management groups across the state, and in some areas of the state, there's even more closure to the idea that, the irrigation district should have to consider issues beyond agriculture when they're thinking about water management. So it's definitely varied across the state if we look at that.
Super. The next question that I'm going to go to is actually, it's just a quick clarification question. It's from Daniel Mountjoy, and then I have a question from Shreyas and then Lara. So you're next, Lara, after Shreyas and Daniel. Daniel's question, I think, is a clarification one, and it's one that I'd be curious about as well. He says, I think that Carolina said that the smaller disadvantaged communities have higher nitrate concentrations in their groundwater. How is this explained, given that all communities share a common aquifer?
Yes. So I think that was what was surprising from the results, because, as I said, the region as a whole has higher nitrate levels, and we wouldn't necessarily expect that based on race or class that community would have higher nitrate levels. One of the basic reasons that could explain that is the geographic location of these communities. So the smaller unincorporated areas tend to be closer and more located in the valley floor, which is where agriculture is happening. And so they're right next to those agricultural areas. So Tooleville, as an example, is right near the orange industry, and it has shallow water tables. And so, like the framework was showing, it's multiple factors. It's not like a direct cause and effect, but when you piece together these multiple factors that are creating the landscape, it helps to show why a place like Tooleville would have higher nitrates. That's one thing. And the other thing is this was nitrate post-treatment. And so some of the larger cities are able to treat their water. So the city of Fresno, the city of Visalia, they can treat for nitrates. And so they have lower nitrate levels. So then that's the capacity and resource issue. So it's this multiplicity of factors that can help explain that.
Super. So the next question is from Shreyas. And Shreyas, would you mind asking your question via audio if I just go ahead and unmute you?
Yeah.
Would you mind asking via audio? Great.
Yeah, hi, Carolina. Thanks so much for your presentation. So I'm also at UC Davis. I'm a master's student in community development, and my question is a little self-serving because I'm doing a research project this quarter around community-based environmental reporting networks like IVEN in California. And so I'm curious about sort of community-based water monitoring that might be happening in the Central Valley, and particularly like you were discussing, there's lack of resources and certainly attention to disadvantaged communities. And so I'm curious like how residents themselves may be involved in the monitoring process, or if there are examples of community-based environmental monitoring projects in these disadvantaged communities around water quality.
Yeah, so there's a few different efforts. I think overall, just because of the federal requirements for water reporting, it's the burden and the onus is on the water system to test water and show they're in compliance. That said, a lot of systems aren't in compliance even with monitoring requirements, so they might not monitor as frequently as they should. So in that sense, it would be great if there was a backup community mechanism that could also be double checking that. And there's been a few efforts a few communities worked with the county to monitor their water quality, and that was more because they're state smalls, which is smaller than a community water system. It's less than 15 service connections, and so they're not required to have the same types of monitoring requirements, and they wanted to know what their water quality is. So there's a handful of communities that have done their own testing with the county. The other type of community water testing that's occurred mainly with nonprofits like the Community Water Center or self-help enterprises is in relation to interim water solutions. And so one solution that I didn't talk about is that some communities are setting up interim water solutions while we work on these longer-term processes. And what that means is establishing point-of-use treatments or point-of-entry treatments in houses individually. And so there's been, it's been a very participatory process with household members helping test their water, or at least being part of it. And then the third place where there's been community water testing is in private well owner communities. So there's another type of community which is several houses that each have their own private well, and they're not considered a public water system. And there they have zero protection in terms of the Safe Drinking Water Act, because if you're a private well owner, you're not required to monitor and no one's regulating you. And so one of the subregions in the Kings Basin study was the community of Easton, and they're on private wells. And as part of the work, they asked for well monitoring because the community residents, we did surveys, and many of them didn't believe that they had contamination and that we should do anything about water. And when they saw the testing results, that was a way of realizing, oh, actually we have high arsenic, high nitrate, high DBCP, and it was a wake-up call. So there's a few different community efforts, but it's mainly been in partnership with other organizations. It's not just community members on their own.
Okay, super. The next question is from Lara. And Lara, I hope it's okay. Would you mind asking your question via audio? If you have your headset, you can just unmute yourself and ask your question, or if your headset's not working, I can ask it for you. But this one's, hi Lara, can you hear me?
Yeah, hello.
Hi Lara, I can hear you.
Hi, great presentation. I had a quick question, which is whether fracking is kind of emerging as a new concern for groundwater quality in the valley.
Yeah, so that's another timely question. So the southern San Joaquin Valley, where Kern County is, that's where there's more fracking, and it is now emerging. In terms of, by emerging, I mean environmental justice groups or community groups are starting to think about it in relation to water and advocacy efforts. So there's more, because there's more fracking efforts in Kern, that's where there's more awareness of the need to work on this. I know the Center on Race, Poverty, and the Environment is starting some type of citizen-based effort of monitoring those efforts. I've only recently heard about this, so I don't have full information, but that part of the valley is where it's more active. And I've felt for a while now that we need to be thinking about it more, but I'd say it's been lower on the list of priorities in recent years, but it's not because it shouldn't be, just because of where there's been movement among the advocates.
Super. So I'd like to go ahead and open it up. Those were all the questions I had that came in via chat. I'd like to go ahead and open the floor up. We have a few minutes and just ask if there are any final questions from the floor. Feel free to unmute your microphone if you have anything. We'll just wait for that for a minute. And as we're waiting, I do just want to say again, thank you so much for the presentation today, Carolina. I know that people got a lot out of it. Folks have been sending me messages all the way through just to say how helpful the presentation was. And I would like to remind everyone that we'll be posting a recording of this to our website. I'll send everyone the link. You're welcome to forward that along to other colleagues who may not have been able to attend today. And if you have any additional questions, I think, like I said, we can answer them now. But I think, Carolina, you'd also be welcome. You'd also be open to having them emailed, right? And we can include brief answers with the presentation recording. So if we hang up today and you think of a burning question, feel free to send it directly to me or to Carolina. She has her email address listed there at the bottom of the presentation. I'll stop talking for a moment and just ask again, are there any questions from the floor? Well, hearing none, we're at 1:30, so that was exactly an hour. I think we'll go ahead and close here then and just say again a very warm thank you to you, Carolina. We have been pleased and proud to support your work all these years, and it's clearly having incredible impact in the region. So we're proud to have you as a part of our network.
Thank you. Yeah, it was great to hear all of your questions, and I really appreciate how Switzer has supported all of this work. So wonderful.
Super. Well, have a great day, and have a great day to everyone else, and we'll be in touch with the webinar recording. Thanks so much for attending.